So we're going to do some vein treatment, and this beautiful lady was asking us what is better, doing the laser or doing the sclerotherapy. All the studies point to the fact that sclerotherapy for the leg veins is more effective and causes less side effects. For the face, the laser obviously is much safer. I've tried everything on myself, not sclerotherapy, but I've done the laser on my legs, painful, and I can tolerate pain. It left me with a brown mark for like over 2 years. I don't even remember how long it took, and I have light eyes. The darker the eyes, the darker the hair, the more likely you have post-inflammatory hyperpigmentation, which means it will become darker, and that darkness can last for a very long time. Besides, it can also leave you with scars because the energy that you have to use is much stronger. The vessel is much further away from the level of the skin, and the laser has to penetrate through layers of skin before it reaches and hits the vessel. So the injection that goes straight into the vein, as long as you do it well, will only deal with the vein and not cause any collateral damage to the skin. A week after we did the sclerotherapy, and you can see her picture on the leg before, and this is only a week after. You can see this is after. So if we move a little further away, we see we did a little bit here. Now the way you know it worked is because not all the vessels are gone. Yes, it is looking better. Is when you press, the blood is still there. So you know that they already went away. There is no more blood there, no more active vessel. For example, if we take another location with vessels, if we take this for example here, and I press on it, you see it fades away. So I press and they fade away. They press and it fades away. I have gloves, it's a little hard to show. But if I press on the area there, you know, it kind of goes away because it goes away. Here on the other hand, if I press, it's still there. So if it's still there, you know that those vessels are gone, they're closed. They're a little bit bruised, but she's doing beautifully after a week. Wonderful.
It wasn't painful at all, it felt normal. Okay, I'm very satisfied.
That's not the reason I'm asking. Did you wear the support stocking for 24 hours?
I wore the support stocking for 24 hours for an entire week. The first 3 nights I slept with them,
Good.
But then after that I didn't sleep with them, but I wore them the entire day.
Oh, so you didn't wear it 24. So ideally you want to wear it 24/7, it works better. Meaning you sleep with them, you're with them all the time. If you need a shower, okay, you shower and then you right away put them on.
Put them on, yeah.
So we understand the idea is 24/7 where the support stocking it works more effectively because you want constantly the injection material, which is the hypertonic selling, to have 100% contact with the vessels, and you don't want new blood to push through and to dilute it and to reopen those closed vessels because it's making like a glue over there. And it eats them away from the irritation. And if it's washed, then the concentration is lowered, and then it can reopen them, and it will be less effective. So we want to put the material, then we want to compress it, and we want to hold it compressed for about a week because that's the amount of time, 3-4 days, for the body to go there, another week, and it continues to heal for about a month.
Okay.
Thank you very much. Hopefully this was educational.